all of our senators are in the studio this morning. We're going to start with the Democrats. Senator McConnell will be along in just a bit. Last week, 10 senators, including Senators Nelson and Rockefeller, who are with us this morning, came up with a health reform plan to replace the plan that included the so-called public option, that is, a government-run health insurance program like Medicare. It would do that by setting up insurance plans run by nonprofit companies, which would be supervised by the government, and it would allow people with no insurance to buy into Medicare beginning at age 55. But now those negotiations, which seemed to be going pretty well last week at midweek, seemed to grind to a halt on Friday. So are we back to square one, Senator Rockefeller?
No, we are not. In fact, I think we have tremendous momentum. I've always believed that, Bob, that as you come closer to taking a vote, that you have to look at this most important piece of legislation in Social Security, and you sort of have to look at the whole thing. It gets harder and harder to stick on one individual subject and say, I don't like that, therefore I'm going to vote against the bill. I actually think that that the momentum is building and that our chances of working well are increasing. And just to give you an example, Joe Lieberman and I are working together on a Medicare control cost factor. Ben Nelson and I are working together on health insurance reform, and I'm really proud of that, and I think that's symbolic.
Well, let me just ask Senator Nelson, do you agree with that, Senator?
Well, I think I can say this, that there have been so many improvements to the legislation now that perhaps it is easier for some. I still have the unique issue of abortion, and while we're going to continue to work together on health insurance reforms, I want to make certain that at the end of the day, whatever we do is the best bill that can be possibly put together.
Well, let me just cut to the chase here. If this bill, as the wording on abortion in it now stands, can you vote for it?
I said I can't support the bill with the abortion language that's there. Unfortunately, the Nelson Hatch
amendment
Casey failed, but I do know that there are some who are right now trying to find language that might be compatible with the Stupak language in the House. That's a tall order for people, and I'm not prescribing ahead what they may be able to do.
Let me ask you this, Senator Nelson, because Senator Rockefeller here seems to be pretty optimistic. You were one of the senators, along with Senator Rockefeller, who worked out this compromise proposal. By working out this proposal, did that mean that you can vote for this proposal?
Well, no, I think it's important to point out that what we put together was something to get scored, or the financial analysis of the
In other words, you voted
CBO.
for something to send it to the Congressional Budget Office to find out how much it costs.
I think we all did. I know that there are those who want to vote for this, but I've withheld my decision on that until you see the numbers and see how it all works. And there are some concerns, of course.
So you're not saying you can vote for this. You're just saying you worked on this proposal to see how much it would cost.
I want to be a friend of the process, and the bill that originally was there was something I could not support. But I have always felt obliged to try to make something better rather than obstruct, and that's what I've been attempting to do.
Why, Senator Lieberman, does nobody really know what's in this bill? I mean, I was watching the Senate debate the other day.
Yeah.
Senator McCain got up on the floor and said he couldn't find out exactly what was in the bill. And Senator Durbin, who's is part of the leadership of the Democratic Party, responded, and I want to put these words up on the screen. He said, I would say to the senator from Arizona that I am in the dark almost as much as he is, and I am in leadership.
Yeah.
Why is it nobody knows what this proposal is that was sent?
Yeah, let me just think, right,
to the Congressional Budget Office.
Right, a very important question, right. On the basic bill, about 2,000 pages, we all know what's in it. But on these compromises, which my friends tell me really we're not agreeing on, as Ben said, but just they agreed that they were interesting enough to send to get analyzed by the Budget Office. Senator Reid has decided that if you let them out, they'll get mauled. And it puts us all in a very difficult position because we don't know exactly what's in them. But I will tell you that on one part of it, the so-called Medicare buy-in, the opposition to it has been growing as the week has gone on. And though I don't know exactly what's in it, from what I hear, I certainly would have a hard time voting for it because it has some of the same infirmities that the public option did. It will add taxpayer costs. It will add to the deficit. It's unnecessary. The basic bill, which has a lot of good things in it, provides a generous new system of subsidies for people between ages 55 and 65 and choice and competition. So, you know, Bob, I think we're at there are not 60 votes for health care reform in the Senate now. We're at a point where, and yet the basis of the bill, covering 30 million people who can't buy insurance today, regulating insurance companies so they treat consumers more fairly, for instance, not denying them health care
So
insurance.
you can't vote for the bill right now. You can't vote for the bill right now. So why do you think that it's going to pass, Senator Rockefeller? Because we know this is going to be 1 or 2 votes here.
I know that. And the reason that it has to be 60 votes, the reason it's so difficult is because every single Democrat and independent has to vote for it. You see, because the Republicans are withholding all of their votes and have been throughout the entire process. And that has to be said to the American people. I mean, it's very hard to pass a bill under any circumstances, but when everything is filibustered, you have to get 60 votes. It's very, very hard.
But
I feel that way,
Yeah.
that it can pass or will pass, because as I say, I think the closer you get, the more you have to look at the whole bill, the more likely you are to say, I have to do this for the nation.
Bob, as I was saying, there's a good basic bill in here, and the parts of it can be supported by 60 senators, including some Republicans. But we've got to stop adding to the bill. We've got to start subtracting some controversial things. I think the only way to get this done before Christmas is to bring in some Republicans who are open-minded on this, like Olympia Snowe. I'll tell you.
Well, what do you have to do that?
You got to take out the Medicare buy-in. You got to forget about the public option. You probably have to take out the Class Act, which is a whole new entitlement program that will, in future years, put us further in the deficit. And you got to adopt some of the cost containment provisions that'll strengthen cost containment that all of us favor. If you did that, you'd have an enormous accomplishment. 30 million Americans who can't afford insurance today would get it. Insurance companies would be more aggressively regulated and costs would be bent down. So it's time to get reasonable.
Well, what about that, Senator
Well, I
Nelson?
think every piece of landmark legislation has had bipartisan support. In many cases, 2/3 or more of the Senate voting for that legislation. That's one of the things that is missing right now. It's not easy to reach across the aisle under the circumstances we find ourselves, highly politicized, very partisan.
Why do you think it's a bad idea to add this buy-in to Medicare, to let younger people buy into this program, Senator Nelson?
Well, first of all, we don't know what the numbers are yet, Bob, and so that's a
You don't know what
important
it's going to
question.
cost.
We don't know what it's going to cost. The second thing is I'm concerned that it's the forerunner of single payer, the ultimate single payer plan, maybe even more directly than the public option.
Senator Rockefeller.
I don't agree. Well, first of all, I introduced the original public option bill into the Senate with a Medicare benchmark because that would have saved $50 billion. I tried to do it in the Finance Committee, they wouldn't listen. I tried to do it in the little meeting, it just wasn't advancing. So I have a decision to make. I mean, I think the public option is a fundamentally correct way to provide competition. I don't think it's a slippery slope to a single payer system at all. I just think it's a very good way. It's a non-profit. They don't have to make any money. But my decision is this. Am I going to say, if the public option doesn't come through, am I going to say, well, count me out? Or am I going to say, you know what? If we are creative and think of other forms of dealing with the health insurance industry, which is public enemy number one as far as I'm concerned in terms of the American people.
Well, would you be willing...
That's my option, you see. That's
would
what I
you
want to
be
do.
willing to vote for health care legislation that did not have the public option and did not have this buy-in to Medicare, which seems to be a non-starter for these two senators?
Well,
right
I'm very much for the buy-in, because that's 30 million plus Americans, only 4 million, and 4 million of them have no health insurance at all.
But would you vote for health care reform if that was not part of it?
I'd have to look at the whole thing. You see, I don't like the question, if this were not a part of it. It is a very important, very huge project, and I have to look at the whole thing. So I'm not going to get trapped by an individual, let's say something I have fought for and I didn't win.
Do either of you think this can pass with the buy-in to Medicare in it? and or a public option if it goes back.
No,
to
they're
that.
not 60 votes for that, because the bill itself does a lot to bring 30 million people into the system. We don't need to keep adding onto the back of this horse, because we're going to break the horse's back and get nothing done. I want to tell you, we could pass a health care reform bill this week with more than 60 votes, and it will be bipartisan if we just took a few things out of the bill as it is today.
We have just a short time. Give me the list of things that have to be taken out to pass it.
Well, from my point of view, no public option, no Medicare buy-in, Class Act, which will add to our debt in the future. It doesn't take much more than that.
And Senator
you got
Nelson,
a great bill left.
You'd have to change the language on abortion for
Yeah,
you
exactly,
to vote for it.
Exactly.
Senator Rockefeller, it's hard for me to think that your optimism is going to prevail here when you hear the statements that these two senators
I know,
have made.
and they're both very good friends. We're both working on major parts of the bill together, and it's not hard for me to feel optimistic. I do,
We're out of
because
time.
history calls on us.